Hello, my name is Shara Vickers. Thank you for joining me today as we discuss obesity among African American women in South Carolina. Before we begin, we'll have a look at today's agenda. Briefly, today we're going to discuss African American women in South Carolina. We're going to look at what's causing or contributing to obesity among these women. We're going to look at what we're currently doing and what more we can do, and we'll wrap up with some final thoughts and a brief overview of the day. Concerned about obesity. Overweight and obesity refer to having a higher than normal or healthy body weight. Obesity is the worst of the two. Overweight and obesity are risk factors for other health problems, including cardiovascular disease and diabetes, and we'll discuss these more as they pertain to this population in the upcoming slides. Obesity and overweight tend to influence self-esteem, and they also affect quality of life. It tends to affect women more so than men. Obesity tends to affect African Americans more than other races, and it's both a personal and a public health concern. Looking at obesity trends over the last several decades, in 1990, no state had an obesity prevalence above 15%, and 10 states had rate of 10%. By 2010, no state had a prevalence below 20%, so that's a huge increase, and 36 states had a prevalence of greater than 25%. By 35% are overweight, and this comes at an estimated cost of $147 billion annually. Looking within the state, in Americans, obesity rates are the highest. In 2017, the prevalence was about 42%, whereas for Hispanics and whites, it was less than 30 in both cases. Americans are disproportionately affected. Looking at the overall prevalence, in 1985, again, we're seeing huge increases over the years here. The rate was about 10 to 14%. By 2001, it had increased to 20 to 24%. By 2016, it was 32%. And this comes at an estimated cost of $8.5 billion annually. And again, that cost is increasing. So, looking at obesity among African American females, they tend to have the highest rates of obesity overall. In South Carolina, 80% of African American women are either overweight or obese. They have higher rates of high blood pressure, heart disease, and diabetes. They also have a higher risk of dying of a heart attack, stroke, or other cardiovascular events. So they're more likely for the event to occur or more likely to develop heart disease, and they have a higher rate of death or as a result of the heart attack or stroke or other cardiovascular events, and that's higher than the average population. Cancer, heart disease, diabetes, and stroke are the leading causes of death in South Carolina, and each of these is associated with obesity. So obesity is something we can reduce or to help reduce risk of these leading causes of death. Here we're looking at a visual model of what's referred to as the socio-ecological model. This is used to understand various levels of influence regarding health concerns. And our health is not just up to us as individuals. We can see that our decisions and the choices we make are influenced by all sorts of intersecting and overlapping layers. We're in fact affected by where we live and what we have access to, state regulations, cultural norms, so on and so forth. And we're going to look at these as they pertain to this population as we continue here. So individual determinants include things like genetics, income, and health beliefs. These are all sort of self-explanatory. Genetics, we know, are a risk factor for obesity, although we're not precisely sure how this affects everyone who is obese, but we do know that there is a genetic component. Generally speaking, people of lower income are of a higher risk for obesity. And our health beliefs are a factor. Whether or not we feel we can change our health, whether or not we feel we need to change our health, whether we can appreciate that our diet and exercise and lifestyle habits, for example, influence our greater overall health. These are all individual factors. Interpersonal factors are things like our family status, whether or not we're married or single. Research shows that being married is actually it's not well established, but in some research there is evidence that women who are African American women who are married may have a higher obesity risk, and that may be due to family strain or things of that nature. However, that's not well established. But family status and family support are a factor. The support of friends is a factor, not just in obesity risk, but also in the ability to lose weight or maintain a healthy weight. A positive patient-provider relationship is important. That's another interpersonal factor. If you don't feel judged by your doctor, or if you feel supported supported by your family doctor or dietitian, it may be easier for you to make positive weight-related changes. Also, just having access to a provider who can help identify that your weight has become a risk to your health is another interpersonal factor that we're considering. Environmental factors include rural dwelling. There are lots of rural communities in South Carolina, and just living in a rural area is a risk factor on its own. This is in part due to the safety of neighborhoods, which again is another environmental risk factor. We tend to think of this as an urban matter in regard to safety, but in rural areas it may not be safe to get out. There may not be sidewalks to walk the streets. You may not actually have anywhere close proximity to walk to, or there may not be a walking park or something like that. So safety is a factor. Access to healthy foods is another factor, and we're talking about proximity access. So whether you live close to a grocery store or whether you live in an area you may have to rely on public transportation, or there may not be public transportation available to get you to a grocery store on a regular basis. So you may have to rely on fast food or other means, convenience stores and the like. Institutional policies are lower level policies that still influence our life. So these are things like worksite policies. And there has been an increase in South Carolina in positive worksite health promotion policies. So these are factors that contribute. Walkable community policies. Several communities in recent years have worked to improve the walkability of communities, making them more pedestrian friendly and cyclist friendly. Health insurance, whether you have access to health insurance, whether you have services covered that may help you to reduce risk for obesity or reduce your weight. These are all institutional policies that may influence overweight and obesity. Finally, looking at some larger level policies, these include things like SNAP and WIC benefits, and whether someone has access to these supplemental nutrition programs and can buy healthy food with them. Healthy food and beverage policies, these are statewide policies that encourage healthy food and beverage consumption in public buildings. And the South Carolina Obesity Action Plan that was drafted a few years ago, and it's made numerous positive steps to help communities and develop better, putting better infrastructure in place to support active living, and providing better access to SNAP and WIC and other services and healthy food choices for people. So these are all policy level determinants. Currently, there are lots of great things going on in South Carolina. As I just discussed, the Obesity Action Plan, the Healthy Bucks program that allows SNAP and WIC recipients to receive additional funding for healthy foods, fresh fruits and vegetables. ScaleDown.org is a great resource for all sorts of obesity-related information, as well as resources for people who are looking to make a positive change. The Eat Smart, Move More campaign is another great program. However, what we're missing is a targeted strategy for African American women. So the recommendation here is to implement the Faithful Families intervention. This is an intervention that was pilot tested in North Carolina. There are numerous resources available. It's been researched there. It's being researched a lot in African American faith-based settings, so churches that are well attended by African Americans. There are lots of resources currently available, so this could be implemented in a way that is fairly low cost. It involved multiple layers of influence because there's individual education involved, but it also requires the church or faith organization to make policy changes as well. So we see that people are getting the support of their religious community or faith community. They're making individual changes. They can bring their family along or make changes to support their family, and they're also being supported by their church or congregation. Generally speaking, in the research, faith-based programs are well accepted among African Americans, and family and social support are very important to African American women. The research shows that this helps to have improved outcomes with modifying risk factors for obesity and making positive, healthy changes. So this is a programming recommendation that I would certainly make. Our concluding remarks: obesity is a concern well worth addressing, and we can see that through the growing rates we've seen here and the health risks. Individuals need the support of state and local organizations, and this Faithful Families is an opportunity to do that. African American women are at an increased risk, and therefore strategies and targeted strategies are important to help these women address this this increased risk, and we need to do more for these populations to help reduce their risk. And that concludes everything for today. If you have any questions, please let me know. And thank you for viewing today's presentation.